present, you can talk. That's more than enough.
Okay, so I'll just um, talk about my project.
Yes.
Give me a minute. Yeah.
Yes, you can start.
So, hi, I'm Dr. Kunal. I'm representing Good4health Lifecare technology, and my product is DQ Care. So, DQ stands for Digital Quotient. So, basically, we are a health tech platform which converts users' personal health data into its electronic version, so that every user gets empowered with the whatever benefits they might get with the digitalization of the data. Like they get freedom from the paper records, emergency access, but the most important, they get a proper tracking of all the tests or all the advices, all the consultations they had done priorly, so that we can club this data and create a data driven insights, and based upon that we can provide them with a clinical predictive analysis and what they can do to prevent or at least delay the occurrence of those chronic diseases. So basically, we are into PHR converting to its electronic version, the health data. Um, Currently in the health industry, what is happening is, various hospitals or various big clinics, they have their own system where they, for their efficiency purpose, they input all the data into their softwares or their electronic system. But in return, patient only gets either a printed paper or a digital paper. So there is no connection between what patient gets and what the computer system of the hospital has. So DQ Care wants to establish that connection, so that if you're visiting different doctors or different hospitals, you will not get different files anymore. A single smart file that you have will get updated every time, so that next time you are visiting a next doctor, but he or she will have a very broader view that whatever has been advised or suggested to you by the previous doctors. And that is how we want to reduce the communication gap, and we want to miss out whatever errors there can be because of this data loss. Our MVP is already ready. We've launched 3 months before, and with this, without any marketing, without any going to the various cities, we have 50 plus registered doctors and 650 plus registered users. And next, we are moving with the other cities. Our target market is, we're focusing on both portion, the doctors as well as the users. In the users, to start with, we are specifically focusing on 25 to 45 age group, because this is the population who has to take care of their children also, their parents also. So filing about their documents, their healthcare is important for them. So this is for our user case. For doctors, we are more focused on general practitioners to start with, because in India 65% of the practice is catered by the general practitioners. Plus, they don't have this kind of systems with them which a bigger hospital has, which is a costly HMI software. Their AMCs is very high. They need a person to enter the data. On the contrary, DQ Care platform for doctor is completely free. Plus, it is mobile. It is on mobile, so you don't need to have a laptop or a desktop for that. Plus, it is the only platform which doesn't charge you anything. In fact, if you are successfully using it, it will pay you for using it. So that is how we are targeting doctors. So to onboard more and more doctors, we are taking channel partnership with various pharmaceutical companies, and to reach out to the users directly, we are using digital medias, and then we are arranging certain camps, CPR trainings, and healthcare initiatives at various institutions and organizations levels. So this is our go-to-market strategy. Team, we have a full time of 8 core members in our team, including CTO. So I am the CEO of the company. I am doctor. I'm anesthesia and critical care is my specialty, and I look for the overall operations. Then there are two more doctors. Then there are CTO and two tech guys and a business head. And so this is about team. Competitors, so like I mentioned, there is personal health record and their systems, and then there are electronic medical records and their systems. We call it as EMR. So in the EMR category, HealthFlix is the leading competitor. In the PHR category, Ika Care is our leading competitor. Both are Bangalore based. Both are doing quite well. But how DQQR is different is they are either working in PHR or either working in EMR. None of the platform is connecting these two. Plus, ours is the only platform which is system, like desktop or laptop free. Plus, it is completely free for doctors. Plus, we are giving royalty money to doctors to utilize to using this. And for user side, the future model that we are currently working on, clinical predictive analysis and prevention measures, none of the platform has this kind of feature where they can make you aware about what all diseases that may arise in the future and how you can prevent this. So these features are our competitive mode. In terms of a business model, so as I mentioned, our doctor app is completely free as of now. So our sole revenue is through patient app, which is a freemium model. So certain features are free, but for data driven insights and analytics, they have to buy a subscription, which is very cheap, like 64 rupees per user for 1 year. So we have family modules where they can purchase a family module of rupees 399, which is for 1 year and it includes 6 members. So this becomes our revenue source. Very soon, we will introduce this paid model for doctors also. So doctor will have two modules, free modules and a paid module. And the paid module will include more advanced features to digitize their practice completely. Plus third, we want to enter into health insurance and health loan facilitation. And fourth one is we are already started working over it. We call it as a DQ care executive feature, where we provide in-house services to the old age couple or a dependent couple or any individual who is not able to take proper care in terms of visiting hospital or visiting doctors. So they can come to our platform, book a care executive who are trained nursing assistants. They go to their home, take them to their doctor, complete their journey and drop off them home and complete their smart file. So we have started with this pilot project at Vapi, and soon we will be, replicating it in the Surat and other cities, and this becomes our fourth revenue source. Till date, as I mentioned, we've been working since last 3 months, and within the last 3 months, whatever updates we got from doctors and patient side, with all those features, we started developing our version 2, and it will be launched on 15th of August. So it will have certain more features. So till date, we are in the pre-revenue. We win 640 users, 50 plus doctors. We've incubated at Surat SVNIT because there was one grant from the government of Gujarat and we got that grant of rupees 2.5 lakh, and that is how we incubated there. And yes, this is all our journey.
So what is your ask for this forum?
So currently we are looking to raise 1 CR against 10% so that we can focus more on main sales and marketing plus product enhancement, because that AI features and AI complete AI modulation we want to do with our product. So that is why that becomes main focus, like 50% and 20% goes into these two things and 10% goes for operations and channel partnerships each, and 10% is the miscellaneous. So that is how we are like distributed our 1 CR fund so that we can scale into at least 10 cities. Because this first year, we have kept target that we want to reach out to 10,000 doctors. So we will reach out to them via direct working as well as via the pharma barter trade. So out of this 10,000 doctor, we are expecting 10% conversion. So by the end of this year, 1,000 doctor will utilize our platform daily, just for the screening purpose or any purpose. So by this way, we will be getting at least 20,000 screenings per day once these 1,000 doctors are onboarded.
Okay.
Plus, if we consider only 1% conversion when we reach directly to the users or to our doctors, so out of this 20,000, every day 200 registered subscribers we will get through our platform. So to build this team and to expand our operation to that particular level, we need a bigger team and bigger management. So that is why we want to raise the funds right now.